Hi everyone. The purpose of the video that I'm making today is to help reduce the fears of patients that are considering having a stellate ganglion block done for a variety of reasons. It's natural to be concerned about having a needle placed in your neck because there are some very dangerous things that can be hit with a needle. The purpose of this video is to demonstrate how use of ultrasound decreases that risk and improves the safety and accuracy of the procedure. So the two structures that we're concerned about with this procedure that are really the most dangerous are both arteries. This is my neck, so you'll see some muscles moving around as I'm talking. So there's the carotid artery right here, and this is the middle of the body, and this is the outside part of the body. And then over here, we have another artery called the vertebral artery. And if we turn on color, we can see the pulsing in both of those structures. That tells us that those are arteries. Okay, so home base for a stellate ganglion block is C6. How do we know that we're at C6? You see this kind of pointy dark structure? It's dark because it's bone, and bone does not allow sound waves to pass. This is called Chassagnac's tubercle, and you can find it in everybody. It looks a little bit different, but it tells us that we're at C6. And you can see that the vertebral artery is right next to that. As we go up in the neck, we see that artery disappear, and then it pops back out again if we go down a little bit. At C6, this artery in 95% of people goes into a bony canal, and it's protected above this level. So we know we're at C6 because of this. Then there's also one of our other clues is this muscle here, which is called longus capitis. And then we have another large muscle down here. So this is longus capitis, and it terminates typically on top of that tubercle. You can see it getting small, and as we go up in the neck, it gets larger, 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 smaller, smaller, smaller. Below that is a muscle called longus longus coli. Where we want our needle tip to be is right here, not next to the artery, but right on top of this muscle, kind of between this muscle and that muscle. Over here you see the scale, which is 2 centimeters. That's less than 1 inch. So this is fairly superficial. We don't typically come straight in, so it is a little bit more than 1 inch because we're going to typically come at an angle down this way. Very commonly we'll come through that muscle, and that's okay because we're going to use a small needle. So the first injection that's done, we like to have this artery out of the way. So we're going to come up just a little bit here. The needle can come in, and we'll see that needle, even though the artery is kind of still in the picture. That's actually probably a half an inch, maybe even a little bit more away. And it's perfectly safe as long as we know where our needle is at all times to do this injection. If you ever lose track of the needle, you just stop, pull back until you are in a safe zone, and re-advance your needle. Once your needle is in this location, then you can do your injection after making sure that you pull back on the needle and not have any blood. For the last several years, our evidence is that if we do a block at C6, okay, and again, there's our C6 hallmark. If we do an injection here, and we also come up in the neck, and what we're going to wait to see is this carotid artery split in two. There it goes. Internal and external carotid. This occurs at C4. That's how we know where we're at. In this view, the location of where we want our needle is still just on top of this muscle called longus colli. You can see longus capitis sits right on top of longus colli. So we want our needle right at this bright line that separates the two. And when we do an injection, we want to see these two muscles separate above and below. It's a very small little space, so sometimes in the very beginning it looks like we're either inside of this muscle or inside of that muscle. But we want to be right at the bright line in between and see these split. And most of the time we're going to see our injection fluid flow down this direction. Here's another bony prominence, but we know that we're not at C6, and you can see it's much shorter and has a different kind of appearance.